back tonight with our Mental Health Thursday segment, of course.
We're spotlighting our children tonight, in particular teens out there. We told you earlier this week about how a 15-year-old boy is accused of beating and stabbing his 16-year-old girlfriend to death.
Yeah, this happened, of course, in Chicago. For many of you, it brought back memories of similar domestic violence cases here in Michiana over the past several years and this year as well. So we wanted to bring in psychotherapist Dr. Erin Leonard to walk us through what every parent and every teen should know. We should not see things lead to this right there, that vigil you're seeing that happened in Chicago a few days ago for that young girl. So I want to start with the obvious. How can you explain the inexplicable? What's happening right now with our kids?
Sure. So, you know, that kind of pathology really starts very early, and usually it's the result of infantile trauma, infantile neglect, infantile abuse, or any kind of significant trauma between the ages of 0 to 2. And then, of course, if there's substantial ongoing trauma in childhood, it can really cause a lot of that kind of rage and the inability to emotionally regulate.
But you mentioned 0 to 2. That's a crucial age, still young, but it's still crucial, right?
It's attachment.
Wow.
Yeah, attachment's everything.
And you know what, teens nowadays, people are so quick to point to music videos, video games, social media, right? Enticing some violence. What do you think about that? Does that have a role in this?
I think it can be, they definitely can, it can be a catalyst. So, you know, there has to be kind of underlying trauma and issues, but it can possibly be a catalyst for rage or for kind of an episode, a rageful episode or something like that.
So more of a correlation than it is a cause and effect.
Sure.
Right.
Got it. What's your advice on how kids go about the power of learning more about their emotional intelligence, their emotional strengths and weaknesses?
Sure. So it's really important if a child has extreme anger issues, or, you know, and every kid is going to lose their temper and, you know, have a meltdown once in a while. Yes. But if this is like very aggressive or violent or destructive, it's really important to get that child help immediately.
Yeah.
Okay.
And what can these teens do if they find it hard to maybe control their emotions? If maybe parents or close ones see that they're kind of acting out already?
Right.
What can they do?
A really good thing is to try some breathing. Well, to get help, to get to a counselor, to talk to someone, and then to really do some breathing exercises. So you can do breathing exercises anywhere. And if a teen, it gets kind of popular. It's called 6-7-8. So you breathe in for 6 seconds, hold for 7, and then exhale for 8. So if you give teens just those basic tips, and they can kind of help themselves regulate, you know, they may be able to step back from the situation and prevent themselves from doing something that can alter their lives and someone else's.
Right. When you notice the signs as a parent, as a relative, when you see the signs in a kid that's so young, how can you address it? You say getting help, and I think there's this misnomer that I don't have money to take my kids to a therapist. What can they do at home? I think that 6-7-8 is important. Is there anything else that they can do?
Absolutely. So if you honor a child's feelings but uphold expectations and rules, what that does is the child will learn to identify what they feel. And when a child can identify what they feel and articulate it, they won't act on it inappropriately. So it's really the parent's job to honor the feeling and then uphold, correct, reassure. Whatever comes next is important, but sometimes parents confuse empathy with sympathy, and sympathy leads to enabling, and enabling can lead to a victim mentality. And a victim mentality, when that happens, it's really tough because the child feels entitled to act out because they perceive themselves as the victim in most of the situations. So it's like, you hurt me, I'm going to hurt you.
Wow.
It's that kind of mentality.
It's reciprocal in a way. Wow, my goodness. Dr. Erin Leonard, we love having you. Thank you so much.
Thank you.
Thank you for being here. Let's get